Let's talk about my GM symptoms and how I got diagnosed. ¿Cómo somos? Fuertes! So I first noticed something is wrong when I was driving home, and the seatbelt was touching my breast and it was causing me a lot of pain. When I got home, I checked myself and I had a bump. It was just very hard and it was very painful when I touched it. So I was already seeing a breast specialist, and I went ahead and made an appointment with her, and she looked at me and she said it was either breast cancer or GM. She had one patient before me with GM, so she had seen it before, and she told me to go get a biopsy. She did give me antibiotics meanwhile, but she was pretty sure it was either or. And so they are very similar and they can be misdiagnosed as one another, so it's very important to get yourself a biopsy. At this point, my breast was hard, painful, and it was red. It also was very warm. It felt warm. I felt feverish, but I didn't have a fever. It was just warm. Like, the warmth was just located on my breast, and it really did look like I had an infection, except I trusted my gut. I know my body, and I've been checking myself since 18. Like, I've had breast issues before, so I do regular checks, and I knew that just something was off, and you really do have to trust your gut, and my gut was telling me that something was very, very wrong. So I did receive my GM diagnosis soon after, and the symptoms that I had in those 3 years was a lot of breast pain. I couldn't wear a bra, obviously because of the flare-ups and everything, but also it was just very sensitive, and I got like these shocks. I call them my electric shocks, because I could be driving or doing laundry, whatever I was doing, and I had to stop because it was so bad. It's kind of like cramps, when you have a cramp and you have to stop. That happened to me, but it was in my breast, and it was very powerful, and I just couldn't do whatever I was doing, so I had to stop and take a sec to catch my breath, and it was very painful. So another big symptom was joint pain. That was a big one, and it was unexpected. After joining the GM community and getting more information, I realized that the majority of us do have that symptom, and I thought it was steroid therapy. It was just something to do with that, and I was not on steroids for some periods of time, and it was still there, and even now I still have that joint pain. It's not as bad because I don't have flare-ups anymore, but when I had a flare-up, I could not walk. There was a point where I went to my doctor crying. I was in so much pain, and there was nothing to do, and it's really horrible. Another big change for me was how often I was getting sick and how prone I was to getting sick. It is considered an autoimmune disease, so my immune system completely changed since before I was diagnosed. I noticed a difference, and I was on medication. They gave like therapies that like steroid therapy, the chemotherapy, antibiotics, all that combo. It just doesn't help. It makes your immune system weak, and there's more explanation to that, but overall you get sick. And of course, the main symptom, which is flare-ups and open wounds, which is just basically the process of getting an open wound, of having holes in your breast, leaking gold stuff and blood. And so, I would notice when I was about to get a flare-up, and I had my own routine that would help speed up the process. And then I think it would take around 2 weeks for it to open. I think the fastest I got it was 1 week. I had it that was towards the end, I knew what to do. And then my breast would stay open. The shortest amount was 2 weeks, and my longest healing time was 3 months. So I did walk around with an open wound for that was the average, 3 months. And during that time you really can't wear a bra, and my shirt hurts. I would just chill at home half naked. It sounds crazy, but like I would even put the breastfeeding pads in my boobs. I would tape them. I had big breasts, so I would get so creative to keep those in place. But yeah, the open wounds are definitely the biggest symptom of having GM. So if you are experiencing any of these symptoms, or your breast looks a lot like the picture I've shown, go get checked, get a biopsy. You know your body best, trust your gut. I've had a total of 3 biopsies because I did get it after being diagnosed in one breast. I got it on the other one a year later. So, and then I started getting different areas of the breasts. So after the 3rd one, I think they just assumed that everything was GM. So yeah, just go get checked. If you have recently been diagnosed, stay strong. You get more information from GM groups like on Facebook and social media. There's not much going on in Google. I think they're starting to have more information for the doctors now. I think starting last year, my doctor started mentioning that they did have more, information that was being given to them. So it is a rare disease. GM is benign, but it's a very serious disease. It can be life-changing. It's painful. So please go get checked, and I really hope this video helps somebody.